Good morning, everybody. Thank you all for joining us today. If I've not had a chance to meet you yet, my name is Zach Gobert, and I am a talent pipeline project manager with the Kentucky Chamber of Commerce. I am excited to meet with you all today and learn more about mental health in the workplace. So, want to give a little bit of background why we're here today, kind of a overview what today's going to look like. So, long story short, we founded RUOK because employers have faced unprecedented circumstances during the COVID-19 pandemic. Barriers to unemployment are higher than ever for most employees. And how can we make employers sure that their employees are being taken care of, staying safe and well, and honestly just managing their mental health? So this webinar will explore how to have conversations around mental health in the workplace, the importance of the conversation, and how it can impact the overall productivity and retention of your workforce. So without further ado, I'm going to turn it over to two of my colleagues, Ashley and Sonia. They are both members of the Workforce Center at the Kentucky Chamber of Commerce, and they can take it away.
Good morning. Thank you, Zach. It's so exciting to be here today. Just a little bit about myself, and then we'll kick it over to Ashley, let her introduce herself. We'll do some housekeeping, and then we'll get started with the presentation. My name is Sonia Osman. I am one of the business liaisons at the Kentucky Chamber Workforce Center. I have about 16 years of experience in HR background in the construction, manufacturing, and retail industries. I hold a bachelor's degree in business administration from Murray State. I also serve as the new director of workforce readiness for the Kentucky SHRM Council. And I also serve as the past president for the Four Rivers SHRM here in Paducah, where I reside. I also am a director for the Leadership Paducah Alumni Association. And I have this year in 2020 was nominated and a recipient of the 2020 Lyle Hannah Spirit Award. And that award is mainly just like an HR professional of the year for the state of Kentucky. Very humbled and excited to receive that award, but I know that there's some big shoes for me to fill as I go forward with this 2021 year. So I'm going to kick it over to Ashley, and then we're going to get started.
I always say, shoo, what a list of accomplishments. And then I always start by saying, I'm Ashley McCarty, business liaison at the Kentucky Chamber of Commerce, and I have 3 dogs. So that's my list of accomplishments, 3 dogs. No, you guys will learn more about me throughout this presentation. So here we go. Go ahead, Sonia.
So we have just a couple of housekeeping items that I want to go over just real quickly. So we will be monitoring the chat box. This presentation will be engaging. So we'll be wanting you to talk with us via either chat box or unmute yourself. So if you're not on mute, if you could mute yourself, that would be great. Also, there's a nonverbal taskbar. If you click on participants, you'll see everyone who's in the room, but there's a nonverbal chat bar if you want to click that as well. So we'll be monitoring that if you want to get our attention. So if you have any questions, any comments, just want to put something in the chat, just go ahead. Again, we have someone monitoring that. We'll be throwing links in there as we go on so that you can click on those links to get to further tools and resources that we will reference to through the presentation. So today's presentation is, Are You Okay? Addressing Mental Health in the Workplace. There's a reason why this presentation is named this, and it's a very unique, inspiring story, and we'll hear that story as we go through the presentation.
Okay, so we'll start off by, I'm going to ask a question. If I ask each of you to describe someone who is struggling with a mental health issue, a mental health disorder, maybe depression or anxiety, what would you say they look like? You can throw it in the chat, unmute yourself. I'd love to hear from you guys. What do they look like? What does someone who's struggling look like? And this is where we interact, because it's going to be interactive. All right, we got the chat box.
Tired, yes.
Tired, like any of us.
Depressed, sad.
Look the same as normal, the same as us. All right, great. So a lot of people say sad, depressed, crying, but these are all facial expressions that have nothing to do with depression or anxiety. You can't see mental illness like you can see a broken bone, but that doesn't make it any less than. It's often invisible, and individuals who struggle with a mental illness or maybe substance use disorder They fight every day for their health. And some people can never understand how hard they fight for that. So let's go to the next slide. Looking at this, again, the face of mental health. You can't look at someone and tell they have a mental illness. The face of a mental health disorder can be deceptive, hidden behind wide eyes and smiles and grins and being cheerful, forced in place. These are forced in place to avoid deception or detection. From the outside looking in, people can say, oh, this person has everything. This person has it all. And I don't know if you guys have figured it out yet or not, but this face of mental health is me. This is me as a child. I think that was my kindergarten picture with the little flowery dress. There is my graduation picture. Notice my hair's gone now. And the last picture in black and white, that was me. And actually, I'm proud to say that I am a suicide survivor, because that picture was taken about a week and a half before my first suicide attempt. So there's absolutely no way that you can tell that I struggle with a mental health disorder. Actually, about 40% of people receive treatment for mental illness. What does that leave? If we calculate it, it leaves about 60% of individuals go untreated for their mental health disorders. So again, the face of mental health disorder, mental illness. This is mental illness, as you can see, untreated, along with co-occurring issues as in substance use disorder. So what is this a picture of, you guys? Throw it in the chat or unmute yourself. What is this a picture of? Where is this individual probably? Okay, it's a mugshot. It's a mugshot. Yep, jail. Everybody's saying that. You're exactly right. This individual is in jail. It is a mugshot. But what you guys don't see is that this individual has to fight every single day for her life. This individual was obsessed with perfectionism, struggled with depression, anxiety. Those are all things you don't see. You can look in her eyes and see it's soulless. It's soulless, just so deep and dark. But this individual was actually a pharmaceutical sales representative before this picture. She was a pharmaceutical sales representative, top 5 out of 10,000 representatives in the entire nation with this pharmaceutical sales company. Then she had a couple surgeries. We've heard this story before, got addicted to opioids, didn't know she was addicted until she tried to stop. Eventually, we're talking about this employee that was top 5, started missing work, calling in, not meeting goals, not even meeting them, let alone exceeding them. And then she went on a business trip to Las Vegas, actually tried to commit suicide on a business trip, was wheeled out on a stretcher through the Bellagio Hotel in Las Vegas, taken to the hospital, and then went into the psych ward for about 2 weeks. Keep this in mind. With this individual during that time, no one ever asked her the simple question, the title of this presentation, are you okay? Simple legal question, are you okay? No one came to check on her at the hospital or the psych ward. No one asked any questions. It was swept under the rug, heads were turned, and it was never talked about. She lost her career as a pharmaceutical sales representative. Then this disease of substance use disorder, mental health, it's progressive. She started using methamphetamine. As you can tell in this picture, that's what this individual was on, was methamphetamine. Got arrested, obviously, went to jail, got court-ordered to treatment, left that treatment, went back on the run, got picked up again, court-ordered to another treatment where she stayed a year. She stayed a year, and now I'm very proud to say that this individual has been in long-term recovery for about 7 years and 6 months, going on 8 years. And I'm also very humbled and proud to say that individual's me. July 20th, 2013, I was given a new life. I've been in long-term recovery for over 7 years. Recovery for not only substance use disorder, but also mental health. I struggle with a few mental health disorders, but that does not define me. That does not define me. You are not defined by your worst mistake. You are not defined by a disease, by a disorder. And you can live well with mental health. It may not be preventable but it is treatable. So thank you guys for letting me tell my story. I just wanted to share that with you guys, and so you could know why the Are You Okay is the title of this presentation.
As we go through today, there's going to be a lot of stats, and we're going to also add a little bit of information from some COVID stats that we received. So it'll be very interesting to hear what those are entailing. So nearly 1 in 5 U.S. adults ages 18 to older, 18.3% of 44.7 million people reported a mental illness in 2016. So let's think about that for a minute. We have about 43 people in this room right now listen to this presentation. So that's about 8 individuals that are struggling with this mental illness. And 44.7
I always say, I'm
million
one,
people,
Sonia. I'm one.
7 million people is a lot of individuals. And as Ashley told you, there's 60% of them that are untreated. So as business leaders and HR professionals and those individuals that manage this population, we really need to take heed on, like, what are those questions we need to ask? What are those red flags? What are we missing, or what are we not seeing? So as we go through that, make sure that these notes are being taken, because we will give you those answers. So by addressing mental health issues in the workplace, employers can reduce healthcare costs for their businesses and employees. And what we found out when we researched this stat here is that by combining medical and behavioral health care in your benefit plans, the U.S. could save 37.6 to 67.8 billion with a B dollars on an annual basis. So again, as business leaders and those who design our business plans, we really need to be asking those questions. How can we combine this? How can we offer this? How can we educate our employees to understand that treatment is there and it is available?
I forgot to add that I don't know how many times I've heard, you don't look like someone who struggles with a mental health disorder. You don't look like someone who is in active addiction. Like I said, it's still a condition, and it doesn't make it any less real, and you shouldn't be defined by that. But what I wanted to add is that this is why we have to start the conversation about mental illness. We have to openly talk about it, break barriers, fight stigma. I always say we need to have unashamed conversation about this. It may not be preventable, like I said, but it is treatable. But as a workforce, as employers, as organizations, we have to start talking about this. And one reason, because we should be compassionate, but another reason, exactly what Sonia was talking about there. So only 11% of employees discussed a recent mental health problem with their line manager. I ask you guys in the chat or unmute, why do you think that number is so low? Why only 11% are discussing this with their line manager, with their supervisor? Why are they not talking about it? Embarrassed, can be frowned upon. Judgment. Unapproachable. Stigma. Hey, you typed it in as I was saying it's stigma.
Weakness, yeah. No one asked. That's a big one.
Yeah, no one asked. That's huge. And they think it's a weakness, but it's not. They think they may be judged or ashamed or embarrassed, but we shouldn't be these things. So yes, this number is very, very low, and we have to change that.
So before you go to the next slide, I want to throw in a stat there. No, it's okay. You can leave it there.
Okay.
So we got some information, like I mentioned in the beginning, what some COVID reporting and some stats that were done in 2019 to June of 2020. And so one of those stats was, the question was, what colleagues would you feel comfortable speaking to in regards to your mental health? And this, the percentages were like just amazing to me, because 21% of them said their supervisor, which is very low, obviously. 35% said coworkers. 6% said subordinates. And this is the mind-blowing one. And I don't know why it's so mind blowing, because this whole presentation is really about this. 55% no colleagues, which we're struggling with this silently. We're not talking about it. And the reason why is because of all of those reasons that you put in that chat box, and because of disclosure as well, and what that disclosure is going to do to the employee and their understanding of that disclosure.
So these are very important factors when an employee is deciding not to disclose a disability to their employer, whether it's substance use disorder, I'm struggling, I'm struggling with addiction, or mental health, I'm depressed or I have anxiety. So these are all reasons. So 27.9% simply just want privacy. They just don't want anyone to know, probably because of all those things you listed in the chat box. Risk of being viewed differently, 53.8%, treated differently, 57.8%. This one's the one that bothers me. Supervisor may not be supportive. 60.1% of employees do not disclose because they think their supervisor will not be supportive. We have to change these numbers. And then 62%, an employer may focus on, down at the bottom, an employer may focus on the disability. Remember what I said, you are not your disability, you are not your disease, you should not be defined by that. And then the risk of being fired or not hired, 73%. So 76% of line managers believe they're responsible for employee well-being, but only 22% have received training. So do you guys feel responsible for employee well-being, for your employees' well-being? Why do you think these managers, supervisors, HR, whomever, why do they feel responsible? You can throw it in the chat or unmute. I'd love to hear your voices if you want. I'm just curious, why do you think they're feel responsible for that? Why do you feel responsible for that? Or do you? I'm waiting on the chat box.
I know, it's like blowing up. I'm like waiting for it to
I know,
go
I'm like
off.
waiting for somebody. Because you work with these people every day. Oh, they're the most important. We are a team. Employers are our greatest resource.
Yes, great answers.
Compassion, empathy, we're a team. They're assets, great. But guess what? Only 22% have received training. So you feel responsible, but if someone comes to you and talks to you and speaks with you about this, do you know what to say? Do you know how to respond? Do you know who to send them to if you don't know how to respond? Because only 22% are receiving training on how to appropriately address this. Julie says, I struggle with that because we are a team. I usually can go overboard with the responsibility. All right, so we have to get training. That's why we're doing this today.
So like the slide said, 22% only receive training, but 49% of line managers would appreciate just a basic training in common mental health conditions. And what does that mean? Just like, what are those signs? What are those indicators? What are those, in Ashley's case, like she told you when she was the pharmaceutical rep that she was number 5 in 10,000 reps. And that's a powerhouse. That's a superstar employee. And once one of those employees starts to spiral, as a supervisor, manager, leadership team, it's our responsibility to go, like, what is happening here? What is going on? Something is not right. She's not meeting that need. She's not meeting those metrics. What's going on with her? And why are we not dialoguing a conversation with her? And sometimes managers are not comfortable having those conversations. And this is the reason why they just want some basic information just to start the conversation and to lead them to or direct them to whoever that is in the organization that takes care of these matters or these situations. So remember that basic mental health conditions, they want to understand, they want to learn.
I was going to add on you because you brought me up. back to the chart of why someone doesn't disclose, that's exactly why I did not disclose. But I mean, it was pretty apparent when I tried to commit suicide on a business trip, but I hadn't disclosed it because I didn't think my supervisor would be supportive. I thought, yes, I would get fired. And guess what? I did lose my job. But I thought all those things, and that's why I didn't come forward. So we have to change this. So what are the signs that a team member or one of your colleagues or a manager or a supervisor, whoever you work with, may be experiencing a mental health issue? Because I don't want you guys just to think it's just the employees. You know, it's supervisors, it's managers, it's CEOs. It does not discriminate. So continuous changes to physical functioning and or appearance. I always make the note that when it comes to physical functioning and appearance, if I am not well with my mental health, it is a struggle to get out of bed. Physical functioning. It is a struggle to take a shower, to change clothes, to get ready, to put on those cheery smiles and bright eyes. It's a struggle. So sustained changes to cognitive processes, it's hard to put thoughts together. It's hard to it was hard to meet those goals, let alone exceed those goals, let alone to understand what I was supposed to be doing, because your cognitive process can be affected. Constant changes to social interaction. Maybe you have a social butterfly and now they're isolating. They don't talk to anyone. They go to work, they go home. Maybe they didn't used to do this. It interrupts their day-to-day activities, their daily life. Inappropriate behavior, that's different for absolutely every disorder, but it's just, you know, behavior coming from an individual that you're like, they wouldn't have normally done that or said that or acted that way. Maybe they get real defensive or real angry over something, and you're like, whoa, you know, what's going on here? This isn't normal. You don't usually act this way. And then frequent absences or reduced work engagement. If it's hard to get out of bed and it's hard to take a shower and put on clothes, of course you're going to have frequent absences. Of course you're going to have reduced work engagement. Of course you're going to be calling in, not showing up, not meeting goals, let alone exceeding goals. So these are all signs that someone may be experiencing a mental health disorder, all these changes.
You know, and as,
go ahead, Beth. Beth, go ahead.
As we look at COVID, this is like the new normal. If you want to, you know, and as we're going through this, like we laughed. I mean, y'all look so great today. You know, now I don't know if you're wearing shorts and mismatched socks, okay? And that's okay, but that's the whole thing about it too. We have, you know, changed, and that is a reflection. You know, what do you do, you know, at 9 o'clock at night? Well, I changed my day. I put on my night pajamas from my day pajamas, you know, and all those things are cognitive. I don't think shows up as much, but there's the social interaction's gone away. Who would know if I have inappropriate behavior in my own home, you know, and I'm, you know, maybe my family, you know, a lot of times. And then of course, some of that, you know, some people can work from home, some people can't. And it's just, if you look at it, it is a prescription, and we're seeing the results. The numbers are crazy.
Yeah.
So
yes,
we just have to continue to address it.
And Sonia will give you some, I don't think you've given one. Sonia, you have numbers on the COVID, right? Yeah, Sonia will give you guys some numbers on the COVID. But yes, and yes, I do have on shorts and house shoes. No, I'm just joking. As soon as you took a drink, I said it. No, but I do have on house shoes. But yeah, we have to take notice of all these things. And even inappropriate behavior could be in a conversation. Maybe you're working from home and you have a one-on-one meeting with your supervisor or manager or someone, and that inappropriate behavior shows out in aggression or defensiveness. So yeah, thank you for your comment, Beth.
Yes, the COVID stats will be sprinkled throughout the presentation. So yeah, we have a few more of those to come. So they're very interesting. So let's talk about the signs. Know the 5 signs. First is a personality change, which is a sudden or gradual change in the way that they typically behave. And Ashley alluded to this earlier, where you have someone that is just like a social butterfly, and they're just always talking, and they're just always, everything's so happy and going. And then all of a sudden, they're just kind of taken back. They're just to themselves. They just come to work and they just kind of do their job and go home, and no conversation, kind of avoiding those types of situations. Agitated, problems with controlling their temper. They get anger easily, irritable, can't calm down. They're very restless. Just anything will set them off, where normally it wouldn't do that. Withdrawn, they isolate from their family and friends. They stop the activities that they normally do. They pull away from every social support systems that they have. They don't want to be involved anymore. They just want to be there themselves. Poor self-care. They stop taking care of themselves. They engage in kind of risky behavior, maybe some legal matters or things of that nature. And then they use poor judgment when it comes to decision making. And then last but not least, hopeless. They're optimistic about finding anything to hope about. The world will be a better place without them. They contemplate suicidal thoughts, maybe even attempt it. So, these are very prevalent signs that you can see in someone that really just kind of isolates and just draws back in from themselves to where they normally are. Again, you go back to that, that star player in what's going on in that environment in which they are in.
I don't know if you guys, some people don't look at the chat or don't, I just want to read this to you. I think this is awesome. So Zach said, being someone who likes to stay busy, COVID has forced me to learn new coping mechanisms. I can fully agree. It's hard to realize sometimes in the virtual world who is struggling. Yes. I found, especially over the past year, frequently just checking in on those you care about and even asking them, are you okay, can have such a great benefit. Thank you so much for that, Zach. That is so true. That is so true. To learn new coping mechanisms, and we have to start asking people, whether it's work or not, just people in general, are you okay? I message Sonia almost every morning and say, are you okay? Because that's our presentation, but I really know, are you okay? And talking about the getting up and getting dressed, like we have on our blazers and jewelry today, we have to do that. I have to do that, I know, to keep my mental health well. There are days, yes, when I don't get fixed up, but I have to keep that daily routine, or I would go off track.
So important. That routine is very important. We'll talk about that later in the presentation as well, and how important that is. So what should a manager do if they suspect a team member is experiencing mental health? Just like HR individual professionals, when they do like an investigation, you perform this due diligence before approaching any type of team member with any type of decision that's going on with this investigation. And that's the same thing here. If you find that, I would go back, best practice is to look back on historical, were there counseling sessions that may have happened with this employee? Where have there had some conflict issues that may have happened with a coworker? Is there a development plan? All of those things can give you some type of indicator of like maybe what led up to this. So make sure that you go through that whole process and do that due diligence. Encourage communication. As we noticed in the bar graph that Ashley talked about just being private. You have that 20-something% that just wants to be in a privacy mode with that. However, you can encourage them to communicate when they're ready, if they're not ready yet, or if they're not comfortable with it. Just always let them know that someone is there. Someone has their back to make sure that they are okay. And then consider reasonable workplace adjustments. And we talk about this as safe spaces, telehealth, additional breaks, Do you have a safe space, an extra room office where someone can just go in and unwind if something is going on, or if they're dealing with something at work? Can they take a telehealth with a counselor or a therapist? Do you offer additional breaks for them to do that? Along with this slide, also, I have a stat for COVID that from that same statistical report we received from 2019 to 2020, that individuals that suffered with anxiety, it tripled from 2019 to 2020 from 8.1% to 25.5%. And then depression quadrupled. It was 6.5%. It went to 24.3%. So these are very, very important numbers. As leaders, we really need to understand and take heed on, try to, what are we going to do? What practices are we going to put in place in our organizations to make sure that we can talk about this and open up those lines of communication for someone to be able to open up about that?
Zooming back out to some signs and symptoms. And you might look at this list and say, like the first one, worry or fear. I worry. I have fear. You might say that. But does it disrupt your daily life? That's what I want to emphasize. This is disrupting an individual's daily life. They're obsessed with worrying. They're so fearful of everything. Disrupts daily life. Excessive use of alcohol, tobacco, or drugs. That's exactly what I did whenever I was the pharmaceutical sales rep, because I struggle with mental health. And I quickly realized that, say for instance, opioids, they alleviate physical pain. But I quickly realized they alleviated my emotional pain. The emotional pain, the depression, the anxiety, but only for a short time. They don't take away all that. They only suppress it. So when you stop using those excessive drugs of abuse, everything comes back tenfold. Difficult interacting, we talked about that earlier. Suicidal thoughts and behaviors, we'll talk about suicide a little later. Changes in sleep habits and feelings, inability to function, and low energy. That's a huge one that disrupts daily life. Maybe disrupts daily life because you can't see your family, because you're changing your feeling, or I'm sorry, because you have such low energy. You can't go to work, you call in because you have such low energy. Mood, behavioral changes, uncontrollable emotions like a roller coaster, and appetite or weight change that could go. Somebody muted me. Oops, did you guys hear me?
I think I accidentally did that. Sorry, I was letting somebody in the room.
Am I still muted?
No, you're good.
Okay, because I don't want to hear myself talk. Okay, so these are all signs and symptoms. They disrupt daily life. We have some things in the chat. I was seeing reaching out is good. So is physical activity. Yes, Sonia will talk about that later. Allows you to focus on oneself and purpose. Good stuff, guys. So talking about depression. So depression interferes with a person's ability to complete physical tasks, okay, about 20% of the time, and reduces cognitive performance about 35% of the time. So if you're an employee, a supervisor, manager, whomever, you're going to work, or maybe you're working from home, whichever it may be. But if depression is going to affect your physical job tasks 20% of the time and your cognitive performance 35% of the time, do you think you want to go to work? Do you think you feel like going to work? Do you think you're going to be a top performer? No. So we have to, it's not preventable, like I said, but it is treatable. We have to help these individuals get help for mental health disorders or substance use disorder. And they'll be amazing employees once they're well with their mental health.
I want to share some survey results. I follow, I'm on LinkedIn a lot. I follow this Mental Health America. This is a really, really resourceful organization, and they just focus on mental health across the board. And I was reading an article on a way to one of our in-person trainings, and it talked about a survey that they put out there. It was from January to September of 2020. and they surveyed 1.5 million individuals, and they took the health screen that they had offered through this survey. And so this is what the results were. Since the beginning of the pandemic, over 80% of those who took the survey scored with a moderate to severe symptoms of depression. So someone that may have not even thought that something was going on before, with taking through this survey and understanding through this process that this Mental Health America put out there, helped them to understand what was going on with them and, you know, how to maybe address that. That is a lot, like 1.5 million people, 80% of that is like 1.2 million people. That is a lot of individuals that are dealing with this at this present moment. And as we look at the workplace, work affects our mental health. So 61%, which is very high, of workers say that their productivity was affected by their mental health. And then 37% of workers said that their work environment contributed to those symptoms. And why? I ask you why. Why do you think this? Why do you think that 61% of workers say their productivity was affected by their mental health? Or 35% say their work environment contributed to their symptoms? Like what could possibly happen here?
So John said work can be a meaningful combining strategy in mental health. Some get their social interaction from work. Working from home affects this.
Yes.
So yeah, I'm sorry.
No, go ahead.
I lost it. I lost it just as quick as I had.
And we talk about stigma a lot too through our 4-part series presentations, and stigma here surrounding this topic is more of in relation to like burning out, getting stressed, and then also with these percentages is that at times I believe we set higher expectation for ourselves than what our company is. It's kind of like that perfectionism. And so that really will affect your mental health as well. And then the other thing that I found really interesting when I was reading and researching this was individuals handling difficult negative feedback, like if through a coaching session or through some type of performance appraisal. Those types of comments and conversations can really weigh on someone if it's not delivered in the right sense and manner. So as we go forward and think about those things, or we in those type of situations, like how do you address that? How do you make that a positive spin on something that could be negative? As managers, we really need to think about that when those conversations are being had too as well.
So we've talked about mental health and we need to address it. We don't need to turn our heads to it. We don't need to sweep it under the rug. So how do we support mental health at work? How do we do that? Sonia will tell you some ways.
Yes, I will. But first of all, I want to tell you that a serious mental illness can reduce a life expectancy by 10 to 20 years. Please make note of that. That is a very important stat. So let's talk about some action steps. Provide mental self-assessment tools. When we talk about that, we talk about wellness programs. We talk about stress assessments. And stress assessments allow individuals to be in different situations and how they react to that. If it's going to be a high stress level or if it's going to be a low stress level, and what is that going to do to them as far as like their mental health and dealing with that situation. And I thought was very interesting is I was researching online these assessments and what they all entailed, and they actually have a self-stress assessment online. I didn't take it, but I thought it was very interesting and I wanted to share. If you want to go out there and do it, I'm going to go back and do it because I'm very interested in seeing what those results are and how they get to that result. So just a little tidbit I want to throw out there to you. Offer health insurance with no or low out-of-pocket costs for mental health medications and counseling. Does your benefit plans offer this? Do you have incentives surrounding this that your employees can take advantage of? And then employers can use data to track progress and measure the effects. And you can do this through utilization reports. They talk about your claims, they talk about your prescription claims. They also show you, if you have a wellness program, how effective it is working within your individual plan designs. And like, what are your employees using and what are they not using? Is that something that needs to be changed? Can you change it midstream to add something that they're going to be interested in and be, because I know there's individuals that are very competitive, and these programs work well in those situations and in those environments.
Did you say utilization reports, Sonia?
Yes.
So can anybody access a utilization report?
Utilization reports can be accessed by employees that have 100 or more staff members. Any organization that has below 100 employees are unable to access these reports. And other benefit planners can give them a similar report to give them like their claims and their prescription usage. However, it will be a very rounded kind of thing, whereas the one that is over 100, it's not indicated to any one individual, but it gives you kind of like a breakdown of like what is spent on, what is claimed on opiates, what is claimed on pain pills, those types of things, and why those are being prescribed as well through medical coding.
Thank you, dear. So another action step, and Zach G, if you don't care to put the Kentucky Comeback website in the chat, I'm telling you guys this because here's an action step. So distribute materials such as brochures, flyers, videos to all employees. All right, so this picture right here, the Maintaining Mental Wellness While Working from Home, is a flyer that Sonia and myself and our team created, and it is hosted on the Kentucky Comeback website. The Kentucky Comeback website is a place that you can sign up and join the network and be an advocate for criminal justice reform. There's an employer resource guide on there, and that's exactly where these flyers, not just this one, but flyers on stigma, substance use disorder, employee engagement, they're all hosted on the Kentucky Comeback website under Employer Resource Guide. And we'll talk a little bit more about that Employer Resource Guide later, but it's in the chat, so I encourage you guys to sign up and join the network.
Yes. Action step: host seminars, workshops that address mental health stress management techniques like mindfulness, breathing exercises, meditation, help employees to reduce anxiety, stress, improve focus and motivation, just like we're doing here today. We have a 4-part series that we offer, and it adds all of this information in there. The last one we have is to disclose or not to disclose, and we talk about the substance use disorder and mental health co-occurring and why employees should and shouldn't disclose that information. Quiet spaces, social support networks. Again, we talk, so those quiet spaces are so important in every respect. So someone can have some privacy to unwind or deal with what is happening in their worlds. And then training. So important. That is like one of my favorite things to do, because you don't know what you don't know. And the more training, the more education that you get, the more you are built easy and comfortable at handling these situations in your environment.
And Zach G, do you have the link for training? Just so you guys know, here's another link where you can sign up for our training, individualized, customized training. We use this as the core, but we have training on substance use disorder, mental health, addiction in the brain, and stigma, to disclose, not to disclose. So I encourage you to get on there, and if you like what you see today, then let us come in and train your supervisors and managers, because we would love to. And it is at no cost, which means free, for all employers due to our partners within this. So please sign up for the training. This says it in itself. Employers should establish a culture that doesn't stigmatize mental illness and encourages employees to seek help if they need it. Remember, I didn't feel encouraged to seek help if I needed it. And remember at the beginning, I said 40% of individuals receive treatment for their mental health disorder, but 60% do not. I just want to emphasize that it's okay not to be okay, but we need to have these individuals reach out and ask for help. So it's okay to ask for help. And this is not a personal failure. So we have to change our culture. And that's something that Sonia and myself and our team can help you with, is changing your culture to be conducive to this. So creating a stigma-free culture. How do we do that? And I think Sonia will tell you some pointers.
Yes. So let's talk about creating the stigma-free culture. So first of all, we're going to do is we're going to see the whole person. A person's mental health condition does not define who they are. And I think Ashley alluded to that more than once early on in the presentation. So we shouldn't look at the person's disease. We should look at the person for who they are and what is happening in their environment in this situation. Offer support. Don't be afraid to reach out if you think someone is struggling. And that's what this whole presentation is about. The simple question, are you okay? Just ask it. You may be surprised at what you hear and the information that you're able to obtain to further assist this individual. And it may not be an individual they're dealing with it inside of themselves. It may be a spouse. It may be a child. It may be a family member that is having this effect on them as well. Challenge misconceptions. Speak up if you hear a coworker spread stereotypes or myths about mental illness. This is one of my ones that I really preach a lot about, because we need to be the voice for the voices that are not being heard. If someone is talking about mental health in a way that is derogatory or inappropriate, I challenge you as a leader, as a business owner, as a professional, to lead by example and step up and smash that stigma. That's the only way that the stigma is going to be reduced, if we step up and do it. It's going to take all of us. We are not on an island by ourselves. We need to be a team. We need to understand that the stigma has to be and needs to be reduced for these individuals to come forward to seek help and for us to be able to help them. And then the last one, so important, mind your words. Use respectful language and avoid labels like crazy or unstable. We don't understand sometimes that when we're having conversations that somebody can just walk in or walk around the corner and you could be saying something and not knowing what this person is dealing with or what they're going through right now at this present moment. So please watch your language. There are better words that you could be using to talk about this subject in a positive way. And I encourage you to do that.
So while we need to end the stigma that is around mental illness, I always say we need to crush it. We need to crush the stigma. So fear of rejection and discrimination can delay the journey to recovery. So sad. Rejection and discrimination delays the journey. These people aren't getting help that they need. I've said it before, most mental health conditions are treatable. Less than a third of employees who need treatment get the help they need due to stigma. And mental health problems are the leading cause of disability across the United States. So this is in your workforce. This is happening. You do know people. You do not know people, maybe because they're hiding it, that are struggling with this, if it's the leading cause of disability in the United States. Next is suicide. I always say this isn't, a fun topic to talk about. It's just not. Sometimes it's uncomfortable, but I can talk about it today because, like I said in the beginning, I am a suicide survivor, and I'm very proud of that God was not done with me yet, that he had a purpose for me. And part of me being here talking to you guys is fulfilling my purpose. So this was amazing to me. 4.19, or let's put it in perspective, 10.3 million adults have serious thoughts of suicide in the United States. I can remember I never felt whole, but I bent until I broke, and then I tried to commit suicide. But I thought I was alone and that no one else ever thought the thoughts I was thinking or felt the way I felt. But if 10.3 million adults are having serious thoughts of suicide, I'm not alone. These individuals are not alone. There are people on this call that have had serious thoughts of it. So we have to keep that in perspective.
So yeah, let me go back to that survey that I mentioned earlier with that 1.5 million. The second part of that survey was that 37% of those that took the survey said that they experienced thoughts of suicide more than half or nearly every day of the previous 2 weeks. That is astounding. So that is 555,000 individuals that were thinking this on top of what Ashley just told you. So yes, as individuals, we really need to, like, again, take heed to all of these stats and what is happening in our environments, in our communities, in our great state of Kentucky.
So the age-adjusted suicide rate increases when the economy is in recession and more people are unemployed, and it falls when the economy is booming and more people have jobs. Right there is a direct correlation between suicide and unemployment and recession. Goes up, goes down when the economy is booming. It goes down when it's booming, goes up when people are unemployed. And then we find that as the country unemployment rate increases by 1 percentage point, the opioid death rate increases 3.6%. ER visit for opioid overdoses increases 0.7. Why am I talking about the ER visit of opioid overdoses? Why am I talking about overdoses? Because a lot of these deaths are intentional overdoses. They are self-inflicted suicides. So these suicides occur from individuals taking opioids in order to commit suicide. I'll just let you know that's exactly how I tried to commit suicide. I tried to intentionally overdose to commit suicide. So we have to keep that in mind. Some of these are intentional. And tips to keep your mental health in check. This is for you. This is for your employees. This is for whoever. If you're checking on these employees and talking to these employees as a supervisor, manager, HR, then you need to keep your mental health in check as well. So here's some tips.
Yes, absolutely. I'm glad you said that, because this is for you. And I mean, you can use these along in your organization as well, but these are really directed at those individuals that are on this call. Keep physically fit. Eat healthy, well-balanced meals, exercise daily, and maintain a regular sleep pattern, maintain routines and set goals. John, just what you said earlier about the physical activity. It's so important. And Ashley told you that she texts me. We text each other both just to make sure that we're okay every day. Even on the weekends, we do that. Because we were traveling so much. I know that I think last January, I traveled 4,000 miles across the state and 3,000 in February. When March came and I had to pivot and stop, I was thinking to myself, what is going to happen? And Ashley and I, we had lots of conversations surrounding this topic. And we had decided as a team and to work, we were working on this project. However, we weren't going to change our routines. We were going to get up every morning. We were going to get ready. We were going to be at our desk. We were going to do what we do every day. Otherwise, I believe that would have spiraled in myself, honestly, for not having that routine and not like changing that mindset of, okay, this is what needs to happen today. This is what's going to keep me in check. I did a lot of walking. I did like 9 or 10 miles of walking at that time, took lots of breaks and made sure that I just kept going and kept going and kept going. But we got to make sure that we keep ourselves in check before we can keep everyone else in check.
So stay connected. Oops, am I froze? Okay. Stay connected. Isolation can intensify mental health. Keep that in mind. So we're talking about the COVID. We're talking about people working from home. So it is vital to keep all lines of communication open to family, friends, and social networking contacts. I always say, make sure they're positive. Make sure these are positive friends, positive family. Now's the time to eliminate those toxic people in your life. I know I have, but now's the time to do that and keep the positive. So value, love self, treat yourself with kindness and respect, avoid self-criticism. I have to say, whenever I was struggling, when I was not in recovery for my mental health, when I was first in recovery for my substance use disorder, gosh, I struggled to value or love myself. I could hardly look in the mirror at myself because I had so much guilt, shame, and remorse. These individuals feel the same. Another reason why I couldn't hardly look at myself in the mirror, I hope I don't get choked up. Sorry, hold on. Because as you guys could see in my mugshot, I had scars all over my face. I couldn't look at myself because of what I had done and how I had abused my body. Whether it be for mental health or substance use disorder, how I'd abused my body and the way my face looked. And I still have those scars today. I still have those scars underneath this. But as I look at them, you know, today I know that I'm lucky because a scar simply means that I was stronger than what tried to hurt me, than what tried to kill me. And my scars tell a story that says I survived. I survived all that. So today I'm in a different aspect. Sure, they still bother me because there is stigma. You know, sometimes I am embarrassed, but I know that I survived and that I'm not a victim, but I'm a survivor. So today I can say I value and love myself. I don't know why. I just had to tell you guys that.
So let's keep positive. Hey, John, thanks for putting that link in the chat box for the suicide prevention awareness. We appreciate that. So maintain a sense of hope, positive thinking, smile, and see the humor in life. Research shows that laughter can boost your immune system, ease pain, relax your body, and reduce stress. So very well said. So very well said. We talk about that. We talk about journaling, like 15, 20 minutes a day, just journaling, like what's happened today? What am I grateful for? And we have a saying that we say, cultivate an attitude of gratitude. What are you grateful for every day? What is it? What are 3 things? There has to be 3 things that you can be grateful for. And just keep positive. You feel like negative sleeping in, you just put a spin on it. And the last one is to ask for help. It's okay not to be okay. And it's okay to ask for help. And you have partnerships with your local mental health providers or support and resources. The Kentucky Chamber has those as well. We can offer those resources and tools to you. Just give us a call, let us know what you need. And then telehealth. Telehealth is huge. It helps you to be in the privacy of your own home if you don't want to disclose or you need to speak with someone regarding a counselor or a therapist and what's happening with in your environment.
I love in the chat. I've been journaling for 40 years now. One of the best self-care, soul care, and personal awareness disciplines, or is that right? Disciplines?
Yes, discipline.
Yes, disciplines. I was like, am I reading this right? That I've ever
That
engaged.
is so awesome.
So much for that.
Yeah,
Go
if you
ahead.
never started, start. It's a great way to just tap in, check in with myself and yourself. So
Absolutely.
Yeah,
That's
thank you for that.
fantastic. Thanks for
Welcome.
sharing.
I need to start journaling because I have to say I'm guilty for keeping it all up here, but I need to get it out on paper.
yeah, and you'll be surprised how, to use the word in a positive way, addictive it is. And so, you know, yeah, it does help. And I'm actually culling all those journals now to write a memoir called Glorious Ruins. So
That's so awesome.
Awesome.
Yeah. Yeah. Well, I'm going to have to start because you put that comment in there, Johnny. I'm going to have to start now because I need to be addicted to something good.
go, Ashley, go.
And before we go on to the next section, because we're almost finished here, but I want to say this. We were in a presentation, we were doing training for, actually it was App Harvest in Moorhead, Kentucky. We came in and trained all their managers and supervisors with the training we've been talking to you guys about. And at the very end, there was a picture put up of Robin Williams. And I'm sure you guys all know who Robin Williams is. You know, he's funny, jokes, had great movies. But what did he do? He committed suicide. He committed suicide. And the phrase said, everyone you meet is fighting a battle that you know absolutely nothing about. So be kind. And that was amazing to me. That meant a lot to me. So everyone's fighting a battle that you know nothing about. Let's be kind. where can you find all this information? Because you guys can go Google this about culture or safety or drug screens or mental health. I promise you, it would take you about 3 months. That's how long it took Sonia and myself and our team to create this for you. So we have created it and put a bow on it. It's the Employer Resource Guide, which is hosted on the Kentucky Comeback website. I think Zach put it in the chat. So this has lots of topics that you can look at, and it's already all there for you. So it's the Employer Resource Guide on Kentucky Comeback website, and Sonia will tell you what's included.
So when we were putting the project together, we were thinking about like what would be the most one-stop shop robust tool resource for professionals that are dealing or wanted to build a foundation for fair chance, recovery friendly environment and reducing the stigma in their organizations. And so here is the content. We talk about the culture. Is your culture conducive to those conversations? We go into background and drug screens. You know, what is that process? Are you going to the EOC guidelines? Do you use that? What process are you using? Do you use the third party? Retention, how are you retaining your employees? Are you engaging with them? And how are you engaging? What is that process? Recruiting, are you tapping into those pipelines that maybe the recovery center pipelines, the TPM pipelines, the newly and just released incarceration pipeline, those individuals with the Department of Corrections and EKSEP, our partners who promote and help these individuals find stable employment. Policies and procedures, I'll talk a little bit about that in a minute. Education, lots of educational tools on the employee website, on the resource guide, that there's links that will, there's content, you read it, there's a link, it brings you to an additional information that will pertain to that topic. Training, just like this, we mentioned in the beginning, we have a 3-part and a 4-part series that you can engage in. We can come into your organization and do this virtually or in person. Benefits, we talk about that benefit plan. We talk about those utilization reports. We talk about those claim reports. We talk about how to build those designs. And then last but not least, additional resources where we partner with SAMHSA and NAMI and FAHI and all of the resources that are in our great state that you can look for that are pertaining to treatment, prevention, treatment, and recovery.
Good question, Nancy. It says, aren't we moving to the term completing suicide rather than committing suicide? It reflects when it's considered a crime like homicide. I say committing suicide or committed suicide because I did not accomplish it. I carried it out. So it would be like, I was thinking of suicide. I wasn't thinking of suicide. I thought of suicide, yeah, but I committed it. I carried it out. I tried to kill myself, but I was not successful. So I didn't actually complete suicide. I just committed it. So that's why I say committing suicide. But yeah, if someone successfully, maybe we could start saying someone who successfully completes suicide. I don't know, a lot of these terms, we do have a lot of these terms where, you know, some people say that's not politically correct or that's not the way we say it. But when I'm speaking of myself, I say committed suicide because I carried it out, so I didn't complete it. But please share your thoughts, Nancy, if you want. Educational flyers, they're hosted on the Employer Resource Guide. Like I talked about earlier, I won't spend much time on these. Stigma, mental health, substance use disorder, employee engagement. Take these, print these off, hang them up, put them up on TV screens. They're PDF files. Send them out in weekly or monthly employee or company newsletters. So utilize these. They're there for you to do that.
So policies and procedures. We specifically did this to build policies and procedures for individual companies, business owners, leaders, professionals who are wanting to update their policies and procedures or build a handbook. All of these samples have been approved by our legal team, but we encourage you, if you're going to use these inside of whatever you're updating a policy or procedure or you're doing a handbook, to make sure that you also follow that through with your legal team due to your industries and what those specifications are. So these are very customized. If you see the sample where the box is, you can put your logo there, and then the blue box is where you type the organization's names to customize and personalize these policies and procedures for your organization. Let's talk about, go ahead.
Sorry. Go. You know, when I have a brain thought, I'm like, no.
No, next slide. So let's talk about our Who's Hiring campaign. This campaign started, I think, second, third week of COVID, where individuals were losing their jobs. And we wanted to find a solution. The Workforce Center at the Kentucky Chamber wanted to find a solution. And the solution was this Who's Hiring campaign. And what you do is you go on there and you post your jobs, whatever is open. It's across the state. It's from Paducah all the way to Eastern Kentucky. There's different regions that each of these jobs are categorized in. You can download the report. The report is updated every 2 weeks, and you can download it on Tuesdays and Thursdays. Also, there's a Fair Chance Who's Hiring campaign as well, where all of the Fair Chance employers are listed on this report. And I believe yesterday we were doing some stats, and I think there's like 475 employers on there with over 7,000 positions that are open currently on that Fair Chance. You can also download that there. I think Zach has put that in the, or Harper has put that in the chat box. So you can just click on that link and find that report. Also, you can see the little box Ulimi. That box will help you narrow down your search. If you are looking for a specific job, like in nursing or manufacturing, you just type that word in there and it'll bring up every one of those jobs across our state in each region. You can find whatever one where you're located at.
Thank you for that, Nancy. And you've made me think. So thank you for that. The QPR training, I'm getting ready to go through that. So that will be very useful to me because just thank you. You've really made me think about terminology on when I do tell my story regarding suicide. So I just want to say thank you for that.
So let's talk about Bust the Business. This is a statewide initiative focusing on connecting students with employers. And the goal of this initiative is to allow students to find career paths in different industries. So on Wednesdays, we have a virtual event where students and teachers and individuals are invited to partake in this virtual event, and they talk about different industries. We've had construction, we've had manufacturing, we've had engineering, we've had various topics that have been talked about. And what they do is they just give these students an overall view of how to set that career path wherever they are in school. Someone wants to be an engineer. This is the schooling they need. This is the type of internship they need. This is what's going to happen next. They give them salary information. They give them just very stats of what's going on in that industry. If you would like to be involved in this, please click on the link and register, and we would more than happy to get you involved in this initiative. And I'm going to turn it over to Zach Gobert, and he's going to tell you a little bit about TPM.
Yeah, so just drop the link in the chat for that as well. So TPM, or Talent Pipeline Management, is what I do for my role at the Chamber. And essentially what we're doing is creating and managing employer collaboratives and engaging in demand planning, competency and credentialing requirements, talent flow analysis, as you can see there on the slides. And we are having data-driven approaches to workforce solutions. So from the US Chamber, we've identified that there's over 6 million available jobs and 6 million unemployed people who are underskilled or underqualified to fill those roles. So we're looking to develop solutions based on the data on how we can solve that. And I know I recognize some of the employers that I work with on the call, so thank you all for joining. But if you're interested in joining any of the collaboratives within my region, I've got healthcare, manufacturing, construction, and business services. Or if you have an industry that's not represented, feel free to reach out to me. I would love to facilitate that conversation with you and see how we can help out.
Thank you, Zach. Yes, Zach. Oh, with some, okay. Thank you, Zach. So Sonia and myself presented today, but Zach's who put it on. So you can thank him for this today. And of course, we have to have a call for action. I love a call to action because remember, I was in pharmaceutical sales. So I always ended with a call to action. Apply these resources, apply them. Don't just look at them. Let's utilize them. And then also, join the network on the Kentucky Comeback website. So this is join us in building a broad-based coalition to dramatically transform the state's approach to addiction and criminal justice in Kentucky. So this employer resource guide also that Sonia, myself, and our team created has information on mental health. So the mental health, the stigma, the substance use disorder, please get on there, click on this link and look at all this because Sonia and myself and our team say that we're here to change hearts, minds, and the bottom line. So hopefully we've changed a few of your hearts, a few of your minds, and contact us and we'll help you change your bottom line in a positive way. So contact us and get up with us, sign up for our training, whatever you feel fit to do. Here we are, in case you haven't seen us for the past little bit today. Here's our pictures. Here's our information. Here's our email addresses. Here's our chamber number. Sonia and myself will put our cell phone numbers in the chat. Please contact us. Get up with us. Let us assist you. Again, it's free at no charge. So maybe take a picture of this with your cell phone. I'll let it linger for just a second. Maybe you can take a picture with your cell phone. You'll have our information.
Yes, and now we have a survey. We were going to take like 1 or 2 minutes. Zach's going to put a link to the survey in the chat box. And this survey will help us to understand what you learned in this presentation, what you would like to see going forward. Please take the time to fill that out for us. We use this information and these metrics to improve our programs and what our network wants to see. So we're going to just take about 1 or 2 minutes to do that. And then we also have some CEUs that we are going to give out for SHRM and HRCI.
I'm going to, about 2 minutes, I'm going to even play you a song while you're doing it. So you can listen to a song. Yeah. Well, where's my song? Well, 2 minutes might be up by the time I find it, right? I lost it. I'm sorry, guys.
Ashley, you could sing it for us.
Okay. It goes something like, it's okay not to be okay. It goes something like that. Here, we'll just pick one. We'll just pick one because this is how I feel.
Do you want to just put the HRCI stuff up there and then we
Thank you for completing that survey. I'm going to stop sharing and we're going to have time for questions and answers. Because I want to see. Oh, I see it.
Josh, look at that mustache.
Hey, Josh, we miss you.
Yeah.
Josh,
So good to see you.
yeah, Josh, we started with Josh at the Kentucky Chamber of Commerce, and we are very fond of him.
Yes, we are. We miss him a whole lot. It's good to see you.
Likewise. Thank you, guys. Miss you all as well.
Anybody have? Go ahead.
No, you go ahead.
Okay. Does anybody have any questions? We are here to give you answers. Any questions, comments, feedback, constructive criticism, teardrops, whatever you guys want to provide us. We would love to hear from you. I want to see some more faces. I want to see some.
Yeah. Like nobody's on here.
If no one has anything, then we'll go ahead and adjourn. Zach, do you have anything else you want to say?
No, I'm just going to say thank you to you guys again, too. I know for me, mental health this past year for both myself and friends has been ever more prevalent than ever. So I appreciate the opportunity to have this conversation. And for everyone that's on here, thank you all for hopping on as well. Like I said, it's so important to reach out to your friends, to your colleagues, to your family, and just make sure that they're okay. I've got plenty of friends that struggle with it. So thank you all for being here. And I know that Ashley and Sonia have a lot of great resources. So if you ever want to be connected with them, please reach out to one of them or me and we'll get you all connected for it.
Absolutely.
Yes.
Yeah.
We would love to come train. All about training. So contact us or fill out that form on